Hello, I'm Dr. James Wilson. Today we're talking about a condition that can change the course of later life without making a sound: osteoporosis. If you are over 65, or you care about someone who is, this topic deserves your attention. Osteoporosis weakens bones gradually, often without pain or obvious warning signs. Many people only discover it after a fracture, sometimes from a simple fall, a minor twist, or even a strong cough. The first break can be a turning point, and what happens next often depends on the habits you build right now. Here's the encouraging truth. Daily choices stack up. What you eat, how you move, how your home is set up, how you sleep, and the conversations you have with your doctor all influence your bone strength and your risk of falling. You don't need special shakes, expensive machines, or intense gym sessions. You need a practical plan, a steady routine, and small adjustments that fit the life you already live. Over the next 20 minutes, you'll learn how to reach realistic calcium and vitamin D targets from food and supplements, how to use protein wisely to support both bone and muscle, and how to exercise in a way that signals your skeleton to stay strong. You'll learn the home changes that quietly prevent falls, the screening tests that reveal your bone status, and the questions that help you and your doctor choose safe, effective treatments. This is not abstract theory. These are steps you can start today, right at your kitchen table and in the room where you're listening now. Whether you already have a diagnosis of osteopenia or osteoporosis, or you simply want to protect your independence, this conversation is for you. The goal is not perfection. The goal is momentum. Let's begin with what happens to bones as we age and why even small, steady choices matter. Bones are alive. Inside every bone, cells are constantly at work. Some cells break down old or damaged bone, and others build new bone in its place. In youth and early adulthood, building slightly outpaces breakdown, and bones become dense and resilient. After midlife, the balance starts to tip. For many people after 65, bone loss accelerates. Hormones shift. Appetite may change. Activity often slows. People who once walked miles or climbed stairs daily may spend more time sitting. Illnesses, surgeries, and medications accumulate across the years and can nudge bone biology in the wrong direction. The process is quiet. You can't feel bone thinning. You can't see density slipping away on the outside. That is why osteoporosis is called a silent disease. However, fractures are not silent. A hip fracture can turn a confident walker into someone who is afraid to step outside. It can lead to hospital stays, rehabilitation, infections, blood clots, and sometimes a permanent loss of independence. Spine fractures are common and often overlooked. A vertebral compression fracture can steal an inch of height in a day and leave a deep ache that doesn't fully go away. Several compression fractures over time can alter posture and breathing, make bending difficult, and shift a person's center of gravity so balance becomes more precarious. Wrist fractures from bracing a fall can make cooking, dressing, and writing painful. The consequences ripple outward, to mobility, to social life, to mood, and to the sense of self. Now for the part many people don't hear often enough. Osteoporosis is not an automatic sentence. Bones respond to the stress you put on them, to the protein you feed them, to the calcium and vitamin D you supply, and to the medications that slow breakdown or build new bone when those are needed. The earlier you build good habits, the better, but earlier includes today. Even in your 70s, 80s, or 90s, doing the right things consistently can slow loss, reduce falls, and prevent the fracture that would send you to the hospital. That is the heart of this plan. Screening helps you and your doctor make targeted decisions. A bone density scan, called a DEXA scan, is painless and quick. It measures the density of your hip and spine and gives a number that correlates with fracture risk. If you're a woman 65 or older and haven't had a DEXA in the last couple of years, ask whether it's time. If you're a man over 65 with risk factors like prior fractures, steroid use, smoking, low body weight, or certain medical conditions, ask whether screening is appropriate. Screening doesn't force you into medication, it gives a foundation for choices. Knowing your bone status lets you match your efforts to your risk. Medication lists matter. Corticosteroids taken for long periods, like prednisone, can thin bones. Some breast and prostate cancer treatments influence bone turnover. Certain seizure medications, thyroid hormone doses that are too high, and other drugs can have an effect. Never stop a prescribed medicine on your own. Instead, bring a complete list to your next visit and ask explicitly how each one affects bones and balance. Your doctor can adjust doses, switch to alternatives where appropriate, or add protective steps to offset risks. With that framework, let's move to the daily habits that rebuild confidence, starting with food. Nutrition is the construction material and the energy supply for your skeleton. 3 pillars do most of the heavy lifting: calcium, vitamin D, and protein. Surround those pillars with a varied plate of vegetables, fruits, whole grains, and healthy fats, and you give your bones what they need to stay resilient. Calcium is the primary mineral in bone. After 65, a practical target for most adults is about 1,200 milligrams per day from a mix of food and, if needed, supplements. Your body absorbs calcium best in smaller amounts, so it's helpful to spread your intake across meals rather than taking a single large dose. If you drink milk, each cup supplies roughly 300 milligrams. Yogurt can contribute 300 to 400 milligrams depending on the brand and style. Cheese adds 200 milligrams per ounce, give or take. If you prefer not to use dairy, you are not out of options. Calcium-fortified plant milks are widely available. Just check the label and choose one that provides 30% or more of the daily value per cup. Calcium-set tofu can be an excellent source if you enjoy stir-fries or curries. Canned salmon or sardines with the bones contribute calcium and protein together. Dark leafy greens add smaller amounts, and while they are healthy for many reasons, you would need several cups daily to reach your full calcium target on greens alone. Supplements can help fill a gap, but they are not a race to the highest number. More isn't better. Going well over 2,000 milligrams per day from food and pills combined is not a good idea and can cause problems for some people, like kidney stones. If you do take a supplement, ask your doctor which form and dose fits your diet and health situation. Calcium carbonate is common and is absorbed best with meals. Calcium citrate absorbs well with or without food and may be gentler if you have lower stomach acid. If you take thyroid hormone, iron, certain antibiotics, or some heart medications, ask your pharmacist about timing calcium so it does not interfere with those medicines. Vitamin D is the gatekeeper that helps your body absorb calcium from your intestines. Food alone rarely supplies enough vitamin D for older adults. Fatty fish like salmon or mackerel contribute a useful amount, and fortified milk or plant milk supplies a smaller amount. But most people over 65 need additional vitamin D to reach a reasonable blood level. Sunlight prompts the skin to make vitamin D, but older skin is simply less efficient at doing this, and many people wisely avoid strong sun to protect against skin cancer. Talk to your doctor about whether to check your blood level and what dose makes sense for you. Many older adults do well with 800 to 1,000 international units daily, though individual needs vary. Taking vitamin D with a meal that contains some fat, like olive oil, avocado, or yogurt, can improve absorption. If your doctor prescribes a higher dose for a short time to correct a low level, ask when to recheck and what long-term maintenance plan to follow after your numbers improve. Protein is the structure that gives bones their internal scaffolding and builds the muscles that help you stay steady. Imagine protein as the ropes and beams of a bridge. Without enough, calcium alone won't protect you. A reasonable goal for many older adults is about a gram of protein per kilogram of body weight per day. If you weigh 70 kilograms, that's around 70 grams daily, spread across breakfast, lunch, dinner, and perhaps a snack. Eggs, Greek yogurt, cottage cheese, chicken, fish, beans, and lentils are all practical choices. If your appetite is small, consider more compact sources like Skyr, strained yogurt, or a half portion of a high-quality protein shake recommended by your clinician or dietitian. If you have kidney disease, Ask your doctor to personalize your protein target before you increase it. To make this concrete, picture a day of bone-smart eating. Breakfast might be a bowl of old-fashioned oats cooked in fortified milk, topped with a generous spoon of Greek yogurt and fresh berries. That single meal delivers protein, calcium, and a steady release of energy. Lunch could be a salmon salad on whole grain toast with a side of dark greens dressed in olive oil and lemon. Dinner might be tofu and broccoli stir-fry with sesame and ginger over brown rice, or roasted chicken with sweet potatoes and green beans. A snack could be cottage cheese with sliced peaches, or a small handful of almonds with an orange. Throughout the day, water is your friend, and so is a cup of tea if you enjoy it. Coffee in moderation is fine for most people, but remember that multiple cups can modestly increase calcium loss in the urine. Balancing coffee with adequate calcium in your diet makes sense. Exercise is the signal your bones recognize loud and clear. Bones adapt to the pressures you put through them. When muscles pull on bone, they send a message to maintain or even build density. Exercise also strengthens the protective system around your skeleton, your muscles, your balance, and your reaction time. Two categories deserve a permanent place on your calendar: weight-bearing movement and resistance training. Layer in balance practice and posture awareness for fall prevention, and you have a complete package. Weight-bearing movement means you are on your feet, and your skeleton is carrying your body weight. Walking is a superb starting point. If you already walk, great. Let's make it purposeful. Aim for 20 to 30 minutes most days, broken into shorter segments if that is more comfortable. If 5 or 10 minutes is what you can do right now, begin there and add a minute every few days. Choose a route that is flat and well lit at first, then experiment with gentle hills or a flight of stairs when you feel confident. If you prefer the treadmill at a community center, that counts. If you like music, light dancing in the living room is weight-bearing too, and it adds joy to the routine. Some people like to track steps, others simply schedule the time. The best approach is the one you will repeat. Resistance training is how you persuade your muscles to hold you upright and protect your joints. You do not need a gym membership or heavy weights. Your own body weight, a sturdy chair, a wall, and a set of light dumbbells or resistance bands are enough. Sit to stand from a chair strengthens thighs and hips and mimics the movement you need for toilets, sofas, and car seats. Wall push-ups train the chest, arms, and the muscles that steady your shoulder blades. A simple row using a resistance band anchored at chest height builds the upper back and improves posture, which is essential for protecting the spine. Calf raises support ankle strength and balance. Hip abduction, moving the leg out to the side against a band, stabilizes the pelvis and reduces wobble when you walk. Move slowly and breathe out during the effort. Start with one set of 8 to 12 repetitions, then rest. If you feel steady and pain-free the next day, build toward 2 sets and eventually 3. Schedule resistance work on 2 or 3 non-consecutive days per week, so your muscles and connective tissues recover between sessions. If you have heart disease, a recent fracture, severe arthritis, or neurologic symptoms, talk to your doctor or a physical therapist before you begin or increase resistance training. Balance practice is not fancy, but it is powerful. Stand at the kitchen counter and place one fingertip on the surface for safety. Lift one foot a few inches and hold for 10 seconds, then switch legs. If that is easy, look at a spot across the room instead of down at your feet and breathe slowly. Next, try a heel-to-toe walk along the counter, placing the heel of one foot just in front of the toes of the other. If you wobble, your fingertip is there. These short drills take a minute or 2 and can be done while you wait for the kettle to boil. Consistency matters more than duration. Daily practice teaches your nervous system to make tiny corrections automatically. Posture awareness protects the spine. Slumping compresses the front of the vertebrae and can contribute to pain and fracture risk over time. Practice sitting tall on your sit bones with your ribs relaxed, your shoulder blades gently drawn back and down, and your chin parallel to the floor. When you lift an object, keep it close to your body, hinge at the hips rather than rounding the spine, and bend your knees. Avoid deep forward bending with twisting under load. That does not mean you must stop gardening or picking up a grandchild. It means you approach those tasks with form that keeps your back safe. Lifestyle adjustments round out the plan. Smoking weakens bone and blood vessels and reduces the hormones that support bone density. If you smoke, ask your doctor for help with quitting strategies today. Alcohol in moderation may fit some people's lives, but heavy drinking damages bone and increases fall risk. For many older adults, limiting intake to a small daily amount or less is prudent. Sleep is a quiet pillar of bone health. Poor sleep is linked with reduced bone density and impaired balance the next day. Aim for 7 to 8 hours most nights. If you snore loudly, stop breathing at night, or feel profoundly sleepy in the day, ask your doctor about sleep apnea evaluation. Treating sleep apnea can improve daytime alertness and reduce fall risk. Home safety is where prevention becomes tangible. Most falls happen in familiar spaces. That means your own home is the best place to shift the odds in your favor. Walk through your rooms with fresh eyes. Imagine you are an occupational therapist evaluating safe pathways. Remove small throw rugs or secure them so they cannot slide. Coil cords away from walkways. Add bright, warm lighting at entries, hallways, and stairs. Install night lights from your bedroom to the bathroom. In the bathroom, place a non-slip mat inside the tub or shower and another right outside. If you ever feel uncertain when standing up from the toilet or stepping into the shower, grab bars are not a luxury. They are the simplest form of insurance you can buy. On the stairs, check the handrail. If possible, having a handrail on both sides provides extra stability. Organize your kitchen so the items you use every day live between shoulder and hip height. That single change eliminates strained reaches and the temptation to climb a chair. Indoors, wear shoes with non-slip soles rather than socks or backless slippers. If you have pets, consider a small bell on the collar so you know when a companion is underfoot. Medication choices can protect your bones when lifestyle steps are not enough. If your DEXA scan shows osteoporosis, or if you have already had a hip, spine, or multiple other fractures, your doctor may recommend medication. The most commonly used medicines slow the cells that break down bone, tipping the balance back towards stability. Others stimulate the cells that build new bone, which is especially helpful for severe cases. Each option has benefits and potential side effects. Some pills must be taken with water on an empty stomach, and you need to stay upright for a period afterward. Some treatments are injections given twice a year. Some are daily or monthly injections for a limited time that build bone quickly, followed by a maintenance medicine that preserves that gain. This is not a decision you have to make alone. It is a discussion about your goals, your other medical conditions, and your tolerance for risk. What matters most is pairing the right treatment with the lifestyle foundation you are building so the whole plan works together. It is time to turn ideas into a week of action. Begin with your plate. For the next 3 days, write down what you eat and drink and estimate your calcium intake from food. Use the labels on your milk, yogurt, fortified plant milks, tofu, and cereals. If you eat canned fish with bones, note the portion. Add up each day. If you consistently fall short of 1,200 milligrams, bring your notes to your doctor or dietitian and ask about a small, tailored supplement to bridge the gap. At the same time, ask whether checking your vitamin D level is appropriate for you and, if so, what daily dose makes sense afterward to maintain a healthy range. If you already take vitamin D, ask whether the dose still fits your needs. Next, schedule a DEXA scan if you are due. If you are uncertain when you last had one, call your clinic and ask. When the result arrives, ask your doctor to explain your numbers in plain language. Ask about your 10-year fracture risk and how that number would change with lifestyle steps or with medication. If you are taking medicines that can increase fall risk, like sedatives, some sleep aids, or certain blood pressure combinations, ask whether alternatives exist that are safer for balance. Do the same review for drugs that affect bone density. You are not asking to stop anything on your own. You are asking for a plan that protects you. On the movement front, write down a simple schedule you can keep. Choose a time of day when your energy is best. Many people find that a short walk after breakfast sets a tone for the day. Others prefer late morning or early evening. Put 2 resistance days on your calendar, perhaps Monday and Thursday or Tuesday and Friday. Keep the sessions short at first. 10 to 15 minutes is enough to feel the work without leaving you exhausted. End each session with a minute or 2 of balance practice at the counter. When you finish, note how you feel. If your muscles feel pleasantly worked and you are not overly sore the next day, you chose the right starting point. If you are very sore or unsteady, scale back the next session. If you feel nothing at all, you can add a few repetitions or a slightly stronger resistance band. In your home, choose 1 change per week. This week, pick up small rugs or secure them. Next week, add nightlights. The week after that, install a grab bar or ask someone to install it for you. Then reorganize your most used shelves. Over the next month, these 4 changes can shrink your fall risk more than you might guess. If you feel overwhelmed, ask a family member to walk the house with you. A second set of eyes notices things you have learned to ignore. If you like structure, create a simple log. Each day, write down meals, movement, sleep, and 1 line about mood or energy. At the end of the week, glance back and choose 1 small improvement for the coming week. Perhaps it is an extra serving of yogurt on 2 days. Perhaps it is 5 more minutes of walking. Perhaps it is moving a lamp to a better angle on the stairs. Let the plan grow gently. Remember that every step you take is banking strength for future you. You have just learned the essentials of protecting bones after 65. The path is steady, not dramatic. Aim for a daily calcium intake that reaches your target without overshooting. Use vitamin D thoughtfully, based on your doctor's guidance. Build protein into each meal so your muscles support your skeleton. Move on your feet most days. Add resistance training 2 or 3 times a week, even if you start with just a few careful exercises. Practice balance for a minute or 2 every day. Adjust your home so it quietly protects you. Ask your doctor for the scans and numbers that reveal your risk, and for a medication plan if you need one. None of this is complicated, but it does require attention. The reward is confidence. Confidence in your footing, confidence in your strength, and confidence that you are doing what is in your control to stay independent. Please remember that this program is educational. It does not replace medical advice. Your health is personal. Your medications, your history, your kidneys, your heart, your joints, and your balance are yours alone. Before you change supplements, diet, or exercise in a big way, talk to your doctor. Bring a list of questions. Bring a list of your pills. Ask directly about bone density, fall risk, and what steps would help most this month. You deserve a plan that fits your life. If this discussion helped you, consider sharing it with a friend or family member who wants to stay steady and strong. Subscribe if you would like more practical, senior-friendly health guidance delivered in plain language. Your bones support you every hour of every day. With a few simple habits, you can support them right back. Stay steady, keep moving, eat well, and I'll see you in the next video. A brief word on hydration and minerals may help. People sometimes focus so hard on calcium that they forget the role of fluids and the supportive minerals that come along for the ride in whole foods. Adequate hydration keeps muscles and joints working smoothly, reduces dizziness when standing, and can even help prevent the drops in blood pressure that lead to falls. Aim to sip water throughout the day. If you use diuretics, or have heart failure or kidney disease, ask your doctor for a personal fluid plan. As for minerals, magnesium in beans, nuts, seeds, and whole grains participates in bone metabolism, and potassium in fruits and vegetables supports overall balance in the body. You do not need exotic powders. A simple, varied diet supplies what you need most of the time, and your doctor can advise if a supplement is warranted for your specific situation. People often ask about collagen powders or specialty bone supplements. Collagen has a reasonable role if your overall protein intake is low, but it is not magical. Remember that collagen is just another protein source, so you can accomplish the same goal with foods you enjoy. As for vitamin K2 or other add-ons marketed for bone health, the research is mixed and evolving. Some people may benefit, but there is not a universal recommendation to add them. If you are on blood thinners or have a bleeding disorder, you should not add vitamin K products without medical guidance. When in doubt, bring the bottle to your next visit and ask your clinician to review the ingredients. Another frequent question is whether a cane or walker means someone is giving up. The answer is no. A properly fitted cane or walker is a tool, not a defeat. It can allow you to move confidently outdoors, navigate curbs, and conserve energy for the activities you love. The key is to get fit by a professional so the height and handle are correct for your posture and stride. A device that is too short or too tall can throw off alignment and create shoulder or back pain. If you notice yourself reaching for walls or furniture at home, that is a sign to talk with your doctor or a physical therapist about an assessment. Many people use a device outdoors and walk freely indoors once their balance training is improved. Footwear choices deserve more attention than they usually get. Shoes that are flexible at the toes but supportive at the heel with a non-slip sole can change how stable you feel on uneven ground. A firm heel counter, a broad base, and laces or straps that secure the foot help prevent slips inside the shoe. Minimalist, backless, or slippery-soled footwear is a risk in older adults, especially on tile or hardwood floors. Try your shoes on the actual surfaces where you live. If you notice sliding or grabbing with each step, it may be time to retire that pair. If you have bunions, hammer toes, neuropathy, or foot pain from arthritis, ask a podiatrist about inserts or shoe modifications that restore confidence. Travel adds a special set of challenges. Airports, unfamiliar hotels, and long periods of sitting in cars can wear on even the strongest legs. When you travel, pack a light resistance band and a small list of movements you know are safe for you. 5 minutes of gentle rows, calf raises, and sit-to-stands in the morning and evening keep your nervous system tuned. Choose a suitcase with 4 wheels so it rolls rather than drags. If you are staying with family, ask for a room on the same floor as the bathroom to minimize nighttime stair use. If the tub is slippery, a simple towel on the floor as you step out can make the difference between a confident morning and a scare. Long flights raise the risk of blood clots, so stand up and walk the aisle when you can and flex, and point your feet regularly in your seat. Hydrate more than usual. These are ordinary steps that shorten the distance between a plan and a good trip.